Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
Today's video discusses slippery pulse and choppy pulse and their clinical indications. A slippery pulse can be seen in healthy people or pregnant women, and the choppy pulse only occurs in a pathological condition. When slippery and choppy pulses are opposite in blood flow smooth degree, the difference that both can indicate phlegm syndrome is explained.
The choppy pulse and the slippery pulse by smooth degree are two opposite characters.
Slippery pulse.
The slippery pulse comes and goes freely and smoothly, like beads rolling on a plate. In ancient pulse books, when discussed what is the slippery pulse, they always use the metaphor as though a bead, let's say the glass bead, you let the bead roll on a plate, so it's very smoothly moving along
from 寸 part to 尺 part.
That's called slippery pulse.
A slippery pulse is formed mainly due to abundant qi in the blood inside the blood vessel, which makes the blood flow smoothly without any obstruction or restraint, just like beads rolling on a smooth floor. If you can increase the blood volume, you can create a slippery pulse. For example, after getting an infusion, or using blood activating or blood stasis removing drugs, vasodilating drugs, etc., the pulse will likely become slippery. In addition, drinking alcohol can also cause patients to have a slippery pulse. Physiological slippery pulse is commonly seen in real life and be a regular pulse. Healthy young people with full qi and blood can often have a slippery pulse. Healthy women before menstruation may have a slippery pulse. During pregnancy, due to the fullness and harmony of qi and blood, women usually have a slippery pulse. The slippery pulse is most apparent after 2 months into pregnancy. In the older days, without modern pregnancy test methods, Chinese people often had to rely on slippery pulse to judge whether a woman was pregnant. Nowadays, the slippery pulse function in telling the pregnancy is not important anymore. Under pathological conditions,
the slippery pulse suggests
an excess syndrome such as
phlegm and retained fluid, food stagnation,
or excess heat. In the excess stage of the yin accumulation, the healthy qi has not declined yet. Sufficient qi in the blood of the body rise to fight against the excess pathogen, making the blood move smoothly. Excess heat can generate a slippery pulse, as the heat can accelerate the blood movement and make the blood move more smoothly. As a result, influenced by the excess heat, the pulse is usually slippery and rapid. For example, in the case of an exogenous fever, when the patient is about to sweat, that is the timing of having a great chance to see the occurrence of a slippery pulse. In addition, if a patient's pulse is still slippery after high fever subsides, the high fever may relapse after 2 to 3 days. In clinical practice, many patients with anxiety or insomnia, if the root is caused by internal disturbance of phlegm heat, often show a slippery and rapid pulse. Please notice that the slippery pulse is observed from the angle of the smooth blood flow and not by the pulse rate. That is to say, a slippery pulse is not necessarily a rapid pulse. For example, if a person has a lot of phlegm in his body and later is affected by external wind pathogens, their pulse can be slippery and floating, not slippery and rapid. though clinically it is common to see the slippery pulse occur along with the rapid pulse. For example, when the phlegm, retained fluid, or food stagnation transforms into fire, a slippery and rapid pulse will present. Slippery pulse usually appears in excess syndrome. In deficient syndrome, the pulse is generally not slippery because the qi and the blood are already inadequate. It is said that a slippery pulse in patients with deficiency syndrome is a sign of the leakage of primordial qi. Therefore, a slippery pulse in a severe chronic disease may indicate the deterioration of the disease.
Choppy Pulse.
The opposite one is called the choppy pulse or rough pulse. This pulse refers to a thready, slow, and short pulse with unsmooth coming and going, like scraping a piece of bamboo. That's the metaphor used to describe what's the choppy pulse. The bamboo have knots. If you use a knife to run over the bamboo, once it reaches the knot part, the knife will go higher, bump higher, so it's not smoothly. You go, higher. That feeling is like you drive a car over a speed bump. You can feel your body will have a kind of bumped higher. Your moving is not smoothly,
but bumpy and shaking.
For choppy pulse, the strength is uneven.
The pulse rate is uneven either. The choppy pulse has 4 characteristics: thready, slow, short, and uneven. The choppy pulse is relatively thin, narrow, and short. The feeling of the pulse beating gives people the impression that the blood flow inside the vessel is sluggish, challenging, and highly unsmooth. The pulse strength is uneven. The pulse strength is sometimes forceful, sometimes forceless. The pulse rhythm is uneven. The pulse is sometimes rapid, sometimes slow, and sometimes there are pauses, even though the pauses are very short and not obvious, giving people the feeling that the blood flow is not smooth. Choppy pulse is only seen in pathological conditions and can be divided into
deficient type and excess type. For the deficient type, it refers to lack of essence and the insufficiency of blood. But in the excess type, it can refer to the qi stagnation and the blood stasis or food phlegm retention. For a deficient type, the pulse must be forceless. So a choppy and forceless pulse indicate deficient syndrome, like lack of the essence and insufficiency of blood, cannot nourish vessels, resulting in the unsmooth circulation of qi and blood. If the blood is insufficient, the movement will be unsmooth. You can imagine if there's blood insufficient, the qi will be insufficient as well, because qi and blood, they are closely connected. Choppy and forceless means deficiency syndrome. The blood and essence be deficient. The blood volume is not sufficient.
In clinical practice, many patients with heart organ disease can show choppy and forceless pulses because of deficient heart qi.
For the excess type, usually you're going to see the pulse condition is choppy and forceful. The forceful is due to the impeded flow of qi and blood. There's a qi stagnation, and qi stagnation lead to the blood stasis. Or there's a food phlegm retention. The food phlegm retention blocks the smooth flow of the blood circulation. That's where you see the choppy pulse. When most of the time we look at the choppy pulse, we will say, oh, choppy pulse indicate the blood stasis. However, it's not the whole story. The choppy pulse can have many other indications. Clinically, many blood stasis syndrome may not be choppy pulse, even people has blood stasis.
But the pulse does not have to be choppy.
Blood stasis can be manifested as other pulse conditions as well.
Such as knotted pulse or intermittent pulse.
You need to combine other examination method to make your diagnosis.
Comparison of slippery pulse and choppy pulse.
The comparison between slippery pulse and the choppy pulse is they are opposite in terms of smoothness. Slippery pulse feels smooth and flowing, and the choppy pulse is unsmooth, like scraping a piece of bamboo.
The slippery pulse is relatively common in clinical practice, and a choppy pulse is relatively rare.
Hi, Mary. You said a slippery pulse can indicate phlegm, and now you say a choppy pulse can also indicate phlegm. What is the difference between them?
This is a good question. We know the slippery pulse and the choppy pulse are opposite regarding the smoothness of blood flow. A slippery pulse focuses on sufficient blood volume, and even if there is some phlegm inside the vessel, the amount is minor or mild. The blood can still move smoothly. On the other hand, a choppy pulse focuses on the impeded blood flow due to qi stagnation. If the phlegm causes qi stagnation, it must be in large amounts and very sticky. Thereby, it can block the blood flow. This type of phlegm is sometimes called old phlegm when compared to the phlegm in the slippery pulse, which is called new phlegm.
If you find this video helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!